Welcome to Enhanced Care's Smart Choices. This is Jerry DeLucio. I'm the CEO of Enhanced Care, and I wanted to take just a few minutes with you to tell you about this seminal opportunity. The Affordable Care Act, as you all know, is addressing a major change in the healthcare marketplace. It creates a mandate for all Americans to have health insurance. Up to 47 million people are uninsured today. 21 million sole proprietors, that's companies of a husband or a wife or both, who are going to be losing their insurance this year. And then all small businesses under 50 employees are going to be transferring their employees from a group plan to individual exchanges. And what does a mandate mean? That means anyone who does not buy insurance is going to be taxed. The average tax bill will be $1,027 this year, $1,540 next year. That is a tremendous amount of money that people will worry about, and they'd have to pay that without any care at all. So we're going to take you through the value of this. First of all, we help people make smarter choices. In one place, we have the most insurance plans and the ability to personalize their plans to get the greatest value for our membership. We have greater convenience and access. All of you know of the power of the Enhanced Care services, having a nurse, a doctor, prescription plan at Walmart. These are all wonderful ways to reduce your healthcare costs. And when tied to your insurance, it actually brings you lower premiums and lower cost overall. And then people will generate savings. You're actually being paid to do this. Our services will help people qualify for a lower plan than the silver plan. As you all know, the government recommends that people buy the silver plan as the most balance between premiums they pay every month and out-of-pocket care when they get sick. With Enhanced Care services and Smart Choices, our people are not the average American. We can qualify for lower premium plans and not be underinsured and at risk. The average savings, and this will be higher for the most part, is $115 a month for a single and $205 per month for a family. How many of you would pay $50 a month for the services of Smart Choices and get $150 lower in your premiums, and it pays for itself right away? And then when you get sick, and we all get sick to some degree, use Enhanced Care to reduce your out-of-pocket costs. Did you know that our membership now is saving an average of $134 a month by using our nurses and our doctors and our prescription plans rather than going out and paying full price? Here's more details around that. More plans, more personalization. What happens when you have more of something in the marketplace? You can make smarter choices, and you'll get better fit, and you likely will get lower premiums. We handle all the federal and state exchanges. So if someone was thinking of going to healthcare.gov or their state exchange, tell them not to go there. This is a much better solution. We also have all the private exchanges in one place. So all the private companies, like if you were going to Blue Cross Blue Shield's exchange in your state or your region, what are you going to see on those exchanges? You're going to see Blue Cross plans. We have Blue Cross and Cigna and Aetna and United Healthcare, and it goes on and on. We target to have at least the top 3 providers in each market and regional insurance companies too. And better for your members, we are certified to provide federal subsidies by the government. So people can get their federal subsidies through us with much more personal service and not any worry about the healthcare.gov issues. Convenience and access. Our services make a difference. We talked about that. Nurses available. The key benefit here as a health coach is that we're going to help people remove unnecessary visits and costs from their budget. 84% of people don't know what their average appropriate care level is when they call for help, and we help make that happen. We have a nationwide network of doctors. 24/7, 365. You can talk to them via telephone, video, or your mobile phone. Our doctors can write prescriptions for you. And new this year, we can write prescriptions for lab work. That's a key benefit. So instead of going to a doctor, paying a doctor's visit to get the prescription for the lab, going to the lab, get your results, and going back, you can use our doctors and pay significantly less. Save hundreds of dollars just in that one incident. Walmart's saving our members 33% on their drugs. And we have over a 60% utilization of our discount plans and alternative mind-body-spirit connections. That's a huge process. And our discounts are saving people up to 50%. And remember, guys, our discounts are guaranteed. So when you have the confirmation of a discount form and you've gone to one of our pre-negotiated providers and you don't get the discount, you send us the invoice and you'll get a check for that level of discount that was promised. There's no risk for anybody. And savings. We talked earlier about the savings. But basically, would you pay $50 a month to get $115 or $205 back on a monthly basis? You bet you will. And then the huge benefit to having Smart Choices is the actual use of the services. If you need care, we're there for you. We'll reduce your out-of-pocket costs, and we make the whole total cost of healthcare work in your favor and not the insurance companies. So this is how it will work. We have a Smart Choice bundle of services, and that is also the gateway to more effective health insurance and total lower cost of your health care. For $49.95 per month, you get the bundle of Enhanced Care services. Enhanced Care MD, the nurse, the drugs, the prescription plans, the doctors, Connect, the discounts to over 500,000 providers. And welcome to Enhanced Care. We've already pre-negotiated. This is Jerry DeLucia. I'm the CEO. And access to the Enhanced Care Private Member Exchange. That's the key. And when you're there, we have live health brokers working for you all year round as your advocates to make the process simple and easy. The health insurance value proposition is this. We give you more choice and more plans, which allows for a greater fit and likely lower pricing just as is. And I talked earlier about the government requires that the silver plans be the center of attention for all people buying insurance off the healthcare.gov site. Versus those silver plans, we're saving people $100 to $200 a month because of Smart Choices. It takes you out of that average category and puts you into a preferred category where you have those services. You're not like everybody else, and you don't need that to be overinsured at silver. And then we have an award-winning consumer experience. You heard all the war stories with healthcare.gov. Well, we fixed all those for our members. And we're going to take you through a little demo, and you'll see how easy this is. We have an 800 number to call our brokers to guide your decisions. And they're there all year for you, not just when you're buying insurance. If you have a problem with the insurer, call our health brokers, and they'll be an advocate for you. And technology also drives satisfaction. We're going to have online chat support where anyone that needs help can just click a chat button. And then we also will have rules and regulations that in an automated sense, if someone looks like they're having problems, they're on a page for too long, we'll pop up screen. Hey, you need some help? Click here, we'll help you. And if care is needed, our services reduce your out-of-pocket costs, saving an average of $134 a month. Next point, we have some serious market credibility here. We are only one of 16 companies that are certified by the federal government to be a web-based entity. That means we could sell subsidies just like the federal government, only better, because we're streamed with them and we have personal assistance in the process. We have licensed health insurance brokers in all 50 states. They help create a superior member experience. We help you choose your plan, fill out the application, submit it, and we're there all year. And then next year, we're one of 6 companies that's approved to be a direct enroller in federal plans. So we'll go right through our own website, won't even stream with the government until we're done. Last, not least, subsidies. A lot of Americans are going to need subsidies. We qualify them, we get them the plan, we have personal attention for them, and we'll fulfill the application for them. So let me take you through the experience and how easy this will be. Now, right now, it's not open enrollment period, so we don't have the ability to register for programs for 2015, but we can register for 2014 programs now. And that's what the top part of the page is. You see that open enrollment has ended for 2014, but you can shop. When you shop here, you're picking actual qualification events. In regular open enrollment period, you don't have to do that. Anybody is eligible. Pre-existing conditions do not apply. This is fully compliant with the Affordable Care Act. You don't have to answer questions about that. You will be insured. So here's how it works. Look at the bottom yellow arrow. Who will need insurance? You have to fill that out. You tell us who you're going to cover. And here's a family of 4. See the female, male, and then 2 children. You put in their date of births. You tell us whether they use tobacco or not. And then you move down the page. Lower on is actually what gives us our competitive advantage over any other exchange in the market. Personalization. You put in your zip code so we know what county you're from, and then you have choices. You'll see that little yellow and green screen on top there. It says personal choice. What that allows our members to do is actually advise us what's their budgetary constraints or their health constraints. Do they prefer to pay very little now, as little as they can, and pay more when they need care later? Or the inverse on the far right, where they pay more monthly with their premiums and then less if they ended up needing care? Well, guess what? We pre-populate the low end of that. See in the yellow box there, that box is checked. So our members, because they are members, automatically qualify for that lowest level of insurance. Now, if they have personal situations, they have some chronic care issues in their family, they can pick any level of that, and we will select plans for them. And then on the bottom part of that page, it says how you typically use healthcare. It's pre-populated again. What we're trying to do is find out how much money you spend on healthcare a year so we can figure out the best plan for you. Healthcare.gov and these other exchanges don't do this. If you leave it defaulted to that box, what happens is we take your age, your gender, your family size, and where you live, and we take an average out of our national database of what people spent in out-of-pocket care. and we assume you're going to spend the average. Now, if you're not average for any reason, meaning you never get sick or you're sick very little, or you have some chronic cases and you go to the doctor a lot or you go to the hospital a lot, you can click Estimate My Own Usage. And there's about 7 questions there that you could fill out, let us know a little more detail about you, and we'll pick more robust plans for you. That's all you got to do. So you fill in who needs insurance. You tell us your zip code. You can default to the lowest price plan, and you can default to the national average, and you click Get Recommendations. Then our engine goes into search mode and comes out with a plan. Now, how simple is this? And it's actually going to be simpler when we come out with the open enrollment plans because we're going to make a bigger deal about the monthly fee. So everybody can target in on that monthly fee there. So you look where the yellow arrow is on the left. It says low premium. So we've searched for that low premium. Now this is Humana. I believe this is Florida. And it's a family of 4 at $426 a month. That's the lowest plan that you're going to be able to find in the marketplace there. Now, what you would do if you look on the right-hand side and you have some filter capability there. The first arrow says carriers. You see how everybody's checked off there? We have Aetna, Assurant, Cigna, Coventry One, Humana, and United Healthcare. You can unclick those, and those would go away from the plan. So for any reason, if you did not like Humana because of a family or a personal situation, you can unclick them and another plan would show up. And then here's the key point, is the next yellow arrow on the bottom, where it says the filters for metals. Now, those are the government healthcare.gov plans. If you clicked silver, your silver cost would come up. So we did it for you, and with this particular case, the fees went up to $627, so that you would basically pay $202 more a month if you were buying on healthcare.gov versus buying on Smart Choices. And that's because you own the Smart Choices services, which makes you different and able to qualify at a plan that would have been something underinsured for you if you didn't. So this is real savings connected to your Smart Choices product. Significant. And then I put the arrow how to compare down there. You see that little compare box? You click on that, and then you also click on the compare box on the first one, and you can compare the two for people. And this is what it will look like. You show the premiums of the two. Monthly premiums, you save a couple of $100 in the monthly premium. There's a deductible difference. Actually, you pay more with the higher plan up front, but the annual deductible is higher on the lower plan in total. Your maximum out-of-pocket cost, you see that there, is about the same. So your overall long-term risk is nothing. And you can compare these things. But here's the points I want to make. You save $200 a month. $50 a month pays for Smart Choices so that you can get those savings. That means you've saved $150 a month, which is $1,800 a year that you put in your pocket. It doesn't go to the insurance company because if it does, whether you're sick or not, that money's paid. Then you got to look at what happens if I need care later on. Well, we can tell you that the average person spends $2,200 a year in their out-of-pocket expenses in medical. We would save you $1,700 of that if you used enhanced care services every time you needed care. So in effect, your total cost will go down by $3,500 a year. You follow that? $1,800 a year for the premiums, and then $1,700 a year if you get sick using our services versus going out and paying full price. That's an amazing amount of money, and it's going to help a lot of people's budget. So affordable care just got more affordable. Then some miscellaneous points. Help is going to be everywhere. No more confusion, no worries. We have a library of articles, FAQs, and facts online for you. We have licensed brokers that can answer questions at any time. They can share information with your insurance company. They can be your advocate. We also do chat support. We have knowledgeable, trained people that are called navigators who are going to help you through the process. And co-browsing. Co-browsing means if you have difficulty or anyone you know has difficulty using the computer, we can actually take over your computer and show you what we're doing and do it for you. And you're there acknowledging what's been done. That's the best of all worlds. And service all year. And included in your bundle services are these health brokers. And they do this. First and foremost, they'll guide you to the right choice of insurance. 2, they'll help you obtain a federal subsidy, better than the federal plans. They'd submit the applications for you. They'll process any claims during the year or handle claim resolutions if they come up, and they'll answer questions not only about your coverage, if this is covered or not, but they can help you plan for next year based on how your health is evolving. And you start to think about your best plan for next year. Any issues with the insurance carrier, you have someone on your side. That's a home run. Using Enhanced Care Smart Choices and the private marketplace we have for members will benefit you and comply fully with the Affordable Care Act at the lowest total cost of healthcare. The bundle is essential. You need the bundle to be able to qualify for the lower premium insurance. So instead of buying silver, we'll move you down to a lower premium and save you that money because you don't need it. And you still won't be underinsured. You'd be even better insured than silver alone. That's important for you to know. So you buy the lower premium plans and you utilize the services that we have. We also personalize for you. Remember those little personalization tools? What's your risk tolerance? How much you want to spend? Do you want a real low-cost plan? Or do you want a high-cost plan because you have some sick children? All that we'll personalize for you and we'll make it better, the best fit. And then with Enhanced Care Smart Choices services, you'll benefit in the long run for your lowest total cost. Those savings are huge, between $100 and $200 a month. And when you net the $50 cost from Smart Choices, you're still talking $65 to $155 a month that goes into your pocket and not the insurance companies. Remember, they never give that back to you if you don't get sick. And you have choice. Choice is in your favor with a private exchange. We have the most carriers. We have the most plans. And finally, when you need care, you got the best plan in the marketplace with Smart Choices services. Save again $134 a month on average. If you're a high user of healthcare, you'll save more than that. So instead of spending money out of your pocket, you'll save every time using us. I want to thank you for your time. We do have to charge a setup fee because not only the setup is pretty complicated with the insurance companies, as you might imagine, but that $15 setup is a small amount of money to save all this and have the right package for everyone. Thank you very much. Have a wonderful day.